All right, now switching gears here, and thousands of Kenyans across the counties cannot access essential medical services, including dialysis, radiography, and laboratory tests, as most equipment procured under the medical equipment services have broken down. Most counties have begun referring patients to the Kenyatta National Hospital for the crucial services, as they lack referrals or even the passwords to operate the equipment. This after the national government failed to extend the service contract to the vendors who have been running the equipment for the last 7 years. Attempts by the Council of Governors to have the contracts extended have fallen on deaf ears, with the national government withdrawing a 6 billion shilling budgetary allocation from the supplementary budget, throwing the whole program into confusion. We get more from our very own Stephen Leto.
In the medical equipment service contract signed by the 47 counties in the beginning of the 7-year contract, upon the lapse of the period, there existed 3 exit clauses, which are either opt for an extension of the contract for a period of 3 years, or opt for a transfer of the equipment to the Ministry of Health, or decommissioning and disposal of the equipment by the contractor. Under the deal, the Ministry of Health was to undertake a survey of all equipment no later than 18 months before the expiry of the contract to establish their usability and netbook value to determine whether or not to terminate or extend the contract. However, failure by the Ministry of Health to make a decision has thrown the scheme into confusion, with the vendors not clear on the way forward. In July 2023, the government engaged the vendors on temporary basis to help service the equipment at a fee, but the service was discontinued after the government failed to pay 3.4 billion shillings fee. Subsequently, the lack of servicing of the equipment in hospitals has left Kenyans in despair, missing critical services, mostly ICU services, renal and theatre services. Majority of the machines malfunctioning and are now under lock and key, with others lacking passwords to operate. This standoff was compounded during a summit meeting held in State House, Nairobi, chaired by President William Ruto in December 19th last year. President Ruto seeking the indulgence of the county bosses to terminate any further financial commitments to the medical scheme. This despite 15 months appeal by the county governors to have the scheme extended in line with the recommendation by a team appointed to review and advise the Ministry of Health on the best option. This was followed by the withdrawal of 6 billion shillings initially included in the supplementary budget to offset the servicing fee. A meeting called on Tuesday at the Kenya School of Government between a team of Council of Governors and the national government team led by Health Cabinet Secretary Susan Nakhumicha failed to broker a deal. The 7 governors, Mudhomi Njuki of Tharaka Nithi, Ahmed Abdullahi of Wajir, Gladys Wanga of Homa Bay, Fernandez Barasa of Kakamega, Mutula Kilonzo Jr. of Makueni, Mutai Kaiga of Nyeri, and Stephen Sang of Nandi have been called again Thursday to join a team from the Ministry of Health to meet the 4 vendors and negotiate with possibilities of reviving the equipment and look into the transition from the medical scheme. Stephen Leto, Citizen TV.